There is something now, that a term that's come to replace it. It's called harm reduction. It's a way of sneaking in and saying, most people when they introduce the concept of harm reduction say, well, really the goal is that people should abstain. But you know, an awful lot of people don't abstain from alcohol, drugs, or from anything. In fact, you really can make the argument that there's nobody in the United States who's abstinent when you see somebody like Rush Limbaugh or somebody like that. The people who put down drugs or seem to be taking other drugs on their own. So in any case, the goal of harm reduction is to minimize the damage that any individual is doing to themselves based on use of any drug. And really, you can extend that concept up and down the spectrum of drug use. Even heavy-duty injecting heroin users can be doing more or less damage to themselves. You can inject a fair amount of heroin as long as you eat properly, don't have dirty needles, don't receive any infections, and don't develop any abscesses or any other administrative infections. You can take a lot of heroin and be okay. Now, we don't like that, and you and I might even agree the guy was addicted, but you can prevent the guy from killing himself or getting AIDS, which is a pretty good goal, because for one thing, somewhere down the line, most of those heroin addicts will probably quit using heroin if you give them some kind of support and enough time. That's true of every kind of substance. I mean, it's probably better to chew Nicorettes than it is to smoke cigarettes. That's another harm reduction technique. Most people don't want their kids drinking, but they really don't want their kids drinking and driving, so a harm reduction technique is to say to kids, you know, we don't want you to drink, but if you do drink, certainly you need to find some way to get home without putting yourself behind the steering wheel of an automobile. And in fact, harm reduction actually resembles much more standard medical treatment for most problems. You're not always able to remedy every medical problem, but what you do is you use a variety of techniques and hopefully engage the cooperation of the patient so that they're able to overcome the worst aspects of a problem or a disease, have the greatest chance for long-term positive prognosis. And in that way, you improve your overall outcomes. By refusing to allow non-abstinence outcomes, we actually guarantee the worst outcomes. We have a perfect example of that. Most other countries in the Western world, for example, the United Kingdom, have avoided the second wave of HIV infection. In fact, we're in the state of New Jersey. 3/4 of HIV infection now comes from IV drug users. It's switched from the homosexual community to the drug injecting community. In the UK and other countries, by endorsing clean needle programs, they've eliminated that second surge of HIV after the homosexual-based HIV epidemic. Not the United States. We're not able to do that. And we're not able to do that because we simply refuse to accept that we should provide clean needles to people that inject drugs. New Jersey, again, is a perfect state. Christine Whitman, who's sort of known as a liberal Republican governor, appointed an AIDS committee, an AIDS council. And she felt she was pretty safe because she chose a businessman, a kind of conservative friend of hers, to head the council. And then she asked for the recommendations, and because everybody in the public health area recommends clean needle programs, including the Centers for Disease Control, the Surgeon General's office, the American Medical Association, this council and this director did their homework and they recommended clean needle programs. And Christine Whitman said, you must be crazy, we're not going to do that. And eventually he resigned and she replaced him with a priest who could be counted on to make sure no such recommendation was made. And New Jersey, and then Christine went so far as to create undercover sting operations to arrest people who were giving out clean needles. And the result of that is, of course, New Jersey has the highest pediatric AIDS rate. 3/4, as I said, of new HIV cases are intravenous drug users. It's a minority problem now. It's an African American and Hispanic problem now. And the data are right there on the New Jersey state website. Everybody knows this. There's no mystery that this has occurred. But somebody like Christine Whitman would say, well, at least we've shown that we don't think that people should use drugs because we don't give them a needles and paraphernalia to take it. And I guess if a lot of people die of AIDS, I guess that's the price we're going to have to pay for indicating our disapproval of drugs. But that's not how medicine normally works. In medicine, and ironically, this stems to some degree from this whole disease approach. Ordinarily in medicine, the concept is you don't make moral judgments, but you try and preserve people's life and health. That's the ultimate goal. And you try and be neutral and value-free in doing that. But we're totally opposite in our approach to drugs and alcohol.